Our fellowship program has, number one, we have amazing faculty, right? And with decades of experience. And the faculty, not only are they, really strong individuals, great forensic pathologists, but they come from training programs all over the country. We also have 2 forensic anthropologists on our faculty, and that's very few offices have that. And we have a forensic toxicologist. It's an amazing facility. It's a great place to walk into every day. We're very well resourced. We have kind of all the bells and whistles for radiography. We have a Lodox. We have a new CT scanner that we've just started using. And just a lot of assets that really facilitate the training. We have urban areas, but we have a lot of suburban areas and a lot of rural areas. And some of the big city programs, you're not going to see a lot of farming type accidents and things like that we offer here, because we have a big footprint in the state of Michigan and serving a lot of different communities with different types of deaths. I'm really proud of the fellows that have come out and are practicing, and they feel good. They feel like they're well trained. The fellows that are training here are seeing a real variety of cases. Obviously, these are decedents, people who have died, but they're seeing a significant variety of cases. I think the other thing that the fellows are seeing is that they're seeing different ways of handling different situations, because we have 7 forensic pathologists who all have their own opinions to a certain extent. We agree on almost everything, but also to have that debate and to have those internal meetings where we're reviewing cases, difficult cases, interesting cases, and to hear everybody's perspective from the faculty, I think is a really valuable piece here. What does it look like on a day-to-day basis, on a week-by-week basis for our fellows? They're surrounded by a really supportive group. And we have younger faculty. We have one faculty member who just finished her fellowship, very close to the fellow in their age and training. And there's a lot of camaraderie there. We've hired one of our fellows who recently finished. And so there's that group of people, but also just as the more senior faculty members, we really build relationships with our fellows. And I think those are clearly lifelong relationships. We really promote a strong work-life balance. So the fellows are working 1 weekend a month, but if you work the weekend, you get a day off the following week. You get a 3-day the following weekend. But we're very focused on that, making sure that if you're on call or you're taking a lot of calls at night, you're not on service the next day. It's really important, because we want to have the fellows be, have that work-life balance, be able to be well rested, and be able to function at a high level. We have medical students, and so that interaction between the fellow and the medical students is really critical. It's one that we encourage and that the fellows get to nurture. So we have students that come up almost every Thursday morning. It's called their ICE experience, the Introduction to Clinical Experience. But that's been a really valuable piece just for not only the students, but for the fellow as well. They really enjoy that relationship that they build with the med students. Kalamazoo is an amazing city. When you're downtown, it's small enough that you get to know people, but it offers a lot. We have Western Michigan University here, which obviously being a college town and a university town, it offers all of the benefits that go along with that. Great restaurants, great shopping, just a lot of things to do if you like the outdoors. There's lakes, there's hikes. The North Country Trail goes through here. But in addition, if you really want some big city time, you're halfway between Detroit and Chicago. So it's not uncommon for people to just shoot down to Chicago. It's a couple hours away, and you can actually get there and spend the weekend there. So it's really it's a smaller community, but really an amazing place to live.